Welcome to KiwaniTalk. We're a public information program put together by people from the Dearborn Kiwanis Club, help from students and faculty at Dearborn High School. We're here at the WDHS studios, my alma mater. My name is Gary Gardner. Welcome to the longest running cable access television show in the entire world. And today I am very excited to have someone who is part of the reason I'm sitting here today, because he's my doctor. Longtime doctor, good guy, and very knowledgeable and very much part of my life, and it should be part of your lives too, Dr. Wassim Younes. Doc, welcome to the show.
Thank you, Gary, for having me.
And
Appreciate the opportunity.
And I say that's true because I've been with Dr. Younes for probably 10 years or so at least.
Almost 2 decades.
Yeah, long, 20 years. Yeah, 20 years. So, and he takes good care of me. He's been exhorting me to do a lot of things, and I started taking his advice recently. It's really been helpful. But before we get into me and my story, let's talk about you and your story, Doc. So, you weren't always a doctor. You weren't always a pharmacist. You came from somewhere. Where did you come from?
So I came from a small village in Lebanon, and that entire village had one physician. And I think, that image of a physician really stuck with me all along. And then we immigrated here, and I went to high school in East Detroit High School. And then after East Detroit, I went to community college at Macomb Community College. And just kind of from humble beginnings, we started, we really didn't have any means. And we kind of were able to, from a taxi driver father to, a mother who's got like a 5th grade education. I think, parents really having a big confidence in you really motivates a child to really want to excel and be something that would improve their family. And I think that was the motivation for me to really go after what my all-time vision of a physician was. And so the first part for me was being a pharmacist, which I'm sure you have a lot of pharmacists that watch this, and that's a profession that I respect very much, because I think that their knowledge base is tremendous. And so I really wanted to apply what you take in pharmacy into another level with patient relationships, just in a different angle. I mean, pharmacists are very crucial for what we do. And so after that, I went to, I did finish from pharmacy, and I did practice as a pharmacist. And then my story from there, I went to medicine. I went to internal medicine at Wayne, downtown, and that was another experience of itself, just to see what the inner city medicine is like and medical care is like. And then that brought us up to the part where we started with you.
And that is, you've got a practice in Dearborn on Mason Street, which is just south of Michigan Avenue, between Southfield and Telegraph. I guess we'll give them some kind of put out there, real handy to where I live. And it's a medical practice. And one of the things that my wife, who is went to college she's a dietitian, and she's a dental hygienist, and she does massage therapy, all those sort of things. She says, doctors spend like 1 semester taking to part-time of pharmacy when they're in medical school, but they're the guys pushing all the pharmacological things on you. How do you think that your background in that may be just not true, but it's kind of what my impression is. How does the background of pharmacy fit into your practice as a physician then?
Right. So I think that brings us up to, every physician has a philosophy on what they want to apply with their patients. And so after practicing for so long, when you have the background about all the effects and all the hesitation that people have and the reluctance to be on medications, you really want to be as natural as you can be. The way God, brought you here is you want to preserve it. So when you really come off of that, if something is going to be affecting that optimal state for you, you have to resort to what's going to help you get to that optimal state. So I think that's the philosophy is, we want to promote wellness as much as we can, and we want to avoid medications as much as possible. We want to avoid interactions of medications as much as possible. And we really want to preserve that wellness. And that's where all that philosophy of preventative medicine, of the weight, the alternative medicine comes into play. And that's really the biggest focus that I think is when we have a very good trusting relationship with a patient, we can really get to that level of advice of, this is the essential medicines that you really need, that you can't go without. We really don't want you to take anything more than you have to, right? Which, that's your philosophy too, because I know you for a long time.
Well, and again, I consider myself sort of a winner of life's gene pool lottery because I don't take any meds at all, really. And that's more through good luck than good lifestyle management. But also, part of it that you've been beating up on me for a long time on my weight. And I'd say I'm a little bit short for my weight. And
but you've made amazing progress.
What happened, I had a little scare back in December. I got some cellulitis. I wound up in the hospital for 3 days with a IV antibiotics in me, and came out, and I've actually lost about 32 pounds since then on a diet. And I've been tracking my blood values and things like that, and really, you can say they've changed much. Not that I needed a whole lot, but some of the things that were borderline have come back down into a range that's pretty acceptable. And
that's probably going to be our biggest focus tonight, is really, your relationship with your physician, and are you really? A lot of times, patients come to us after they're diagnosed, and yes, we're good at treating patients after they're diagnosed. But I think the most beautiful part about medicine is to know your physician and have a relationship to the level to where they're really giving you all the clues about what's coming up ahead in advance. And you really taking these preventative visits to the best. You're really looking and you're forecasting 5 years from now. What can I do not to get to that diabetic stage? This is in my family history. This is what happened to my dad. What can I do not to get there? What are you doing to really fight the anti-aging portion of it, right? How much emphasis are you putting on your stress level and are you really taking into account all the multitasking and the impacts of what you're doing on a day-to-day basis? And are you really carving out just as much time to de-stress as you are to accomplish all these tasks that you have throughout your day? So this is probably going to be our focus of our next discussion here, is going to be that preventative aspect of it, right?
And so the preventative part doesn't have to be really intrusive. It just means going and get your blood drawn once in a while and go see your doctor and have a checkup and have an EKG or whatever. What do you commend?
So for a long time, right, many people looked at an annual or even a preventative visit as kind of a time spent. Really, how much value are you getting from this? And some studies even looked at it in terms of how much is this preventative step saving people from? So I think the answer to that question is going to depend on how in depth really are you reviewing all the elements when you're healthy. Because when you're really healthy, it's very, very difficult to convince a healthy person to carve out time out of their life, especially active, middle-aged individuals that feel great, they exercise all the time, they feel amazing. They really don't anticipate any surprises, right? People don't want to, they don't want to think about it.
I'm good. Why do I have to go see the doc? I feel great, I'm doing okay. That's a little cranky, but no.
I mean, I postpone my dental visits, right?
Right.
I postpone the dentist because I imagine the dentist is going to really be something painful, discovery of something that you really want to postpone. And you really have to face reality. You can't postpone things. Things are coming, right? It's a matter of when do you really want to deal with them. So I think it's the perspective of, I feel great, I feel amazing. How long should I postpone these discussions for? And how long should I postpone this in-depth analysis? And yes, that once a year blood work is kind of the basics, right? It's a good indicator. But I think the risk factors, your personal risk factors, have to be studied. And they have to be studied in a very careful fashion to where, no, you don't have to spend time on them every year to restate and say the whole thing all over again. But just a very strong patient-physician relationship. I have examples that are in my 2 decades of practice that are endless in terms of how many people come back and say, doctor, I owe you my life, or I can't thank you enough for pointing me And sometimes some of these things are random chance, right? You have to say that. You have to say that, you know, sometimes it's screening and it's the physician picking up on certain elements. And sometimes you come across things incidentally, right? I had an example yesterday. I was screening this gentleman, and I think this example may serve. I was screening him for prostate cancer, right? And I did point him into the clues. Okay, look, these numbers are changing. Check for prostate cancer. In the process of doing that, you know, we were screening for other things that happened to his father, and we came across a kidney mass. He didn't expect it. I didn't expect it. And it makes you think, you know, like, he has no symptoms. And kidney tumors, when they come, if you catch them in a specific stage, you save somebody's life. That particular patient was by pure chance. Do I think that, you know, him being under the watch really helped him? It did. These annual visits may many times be, you may do them once a year for a number of years and everything is normal. But that 1 year that you really pick up something, you make a big difference in somebody's life.
So when a patient comes in and you're doing the screening protocol that you have, not just checking all the boxes, but do you look at them and talk to them and the exchange of ideas back and forth? How does that work?
So for me, I really take into account all the elements in that patient's life, from exposure, from occupational exposure, from risks, what they do, what their habits are, where they go, what they're surrounded by every day.
And you're checking all the negative boxes for me right now.
I can, right. So, and at the end of that, I think, you know, you end up really remembering all the things that are specific to that person that you think are going to be risky for him in the next few years, whether they're occupation or whether they're family. For example, I have an entire family that I know in their 50s. This entire family has come to me, and I know that they all get heart disease. There's specific tests that apply to that specific person that comes to me from that family that I would normally not do for a random person. I would be much more attentive to even, you know, looking at their heart calcium score, looking at these early, you know, screening tests that are still in development now, that we have not become a mainstay of screening somebody for their coronary arteries and looking at how much calcium is in their arteries. But in that particular family, guess what? For me, that's a person that I would really screen them early. And yes, I do detect early heart disease in that particular person, much different than another person. And the examples go on to different disease states too, right? So that's I think that's the important of.
It sounds like one size does not fit all.
At all.
No, because you have to tailor. Everybody's different. Everybody has their own things, and it sounds like you take the time and care enough about your patients. Not that other doctors don't, but you exercise a higher level of care in my mind to go, well, let's go a little bit further, let's dig into this sort of thing.
So a lot of times, really, I mean, you could spend an hour or an hour and a half with somebody, or you could spend with somebody a lot less and get to know them. But once you know them, you really don't have to tie up their time. You don't want to tie them up. You don't want to make them feel that they're coming to you. They're going to lose a lot of time to come to you. But all the important elements need to come out from that interaction, right? And yes, part of it is knowing those small details about you know, their background and what happened and everybody. And some people are adopted. Some people don't know their family history. But you know, you will know everything else about what happens with, you know, specific trends or specific clues about them, and you can warn them. And the big element that I think the biggest focus in my practice now that I enjoy the most is weight management. I think weight is really the core of weight, and exercise is the core of the metabolic syndrome, of that whole, all the disease states that are waiting that come out of that, and they propagate and they get worse just because of that.
And we're going to take a break, but before we go, last time I came to see you, I'd lost about 25 pounds. You said, I made you the happiest of all your patients that day. And I'm happy to make my doc happy too. So we'll be right back with Dr. Wassim Younes from Executive Health Services. Don't go away. Get some words about Kiwanis. Come back and talk some more about why you should have a doctor who cares for you and why you should pay attention to him. Don't go away.
It's easy to get caught up in the details. The day-to-day grind, numb to the noise, going round and round and round. Deep down, there's something missing, a void inside, a hole to fill, a life lacking. Then, in a minute of clarity, it hits you. The aha moment. You're needed. Kids need you. Kids of all kinds. All these funny, rambunctious, sweet, attention-seeking, vulnerable bundles of energy. They need your love and support. Some have huge life hurdles. Poverty, disease, hunger. And they're reaching out for you. Around the corner, around the world. You are a Kiwanian at heart, a role model, a guide, a builder of dreams. Together, we are Kiwanis, passionate and strong, ready to move mountains or grains of sand. Imagine every child reaching their potential. The power to help is in you. It's not about us. It's about them. Do you hear the call? Kids need Kiwanis. Kiwanis needs you.
Welcome back to KiwaniTalk. I'm your host, Gary Gardner, with this episode with Dr. Wassim Younes from Executive Health Services. My personal doctor, I'll call him my personal physician. If I was president, I'd have him hired on as the presidential doc. Well, welcome back, Doc.
Thank you, Gary. I appreciate your trust.
So, we talk about how important it is and how the relationship is, and I feel, when I come to see you, I feel real comfortable because you make me feel comfortable. You beat me up a little bit because of things that I should be doing. As I'm approaching 70 in about 3 weeks, I'm starting to pay attention. How do you get people's attention? Sometimes they're not paying attention. What do you do to prod them a little bit?
I think in the first part of our talk we spoke about the importance of that relationship, right? I think that your audience who's listening should really take a step back and look at the relationships they have. How close is that relationship that they have with their physician? Because a physician, to me, is probably going to be the most important relationship you have out of all.
My wife would say something different, but that's
true.
Yeah.
To me, you really you have an opportunity. Yes, it comes in these small little sporadic visits that are, okay, I need something from the physician, okay, I need this or I need that. But I think when it comes to really making big decisions, that early relationship plays a big factor in those later events.
That trust that builds up.
Definitely. And I think that long-term aspect of this, because in internal medicine, same as family medicine, your primary care physician is your protector, that's your quarterback. That should be the person that you really fall back on to really run all the opinions by that come from everybody. Yes, sometimes you do use your primary care doctor as an urgent care, and sometimes you may go years without needing them. But I think the value as you're in your middle age, and those years are very crucial at picking up those early clues. I think from tonight's talk, if I can deliver the most important message that I told you early on about is, when you're feeling great, don't put off those recommended screenings. Everybody that's successful is guilty of putting it off. I have many people that are related to me that I can give examples of now that, you want to try to apply this to them. They're so successful at what they're doing. They'll put off something as simple as a mammogram, a colonoscopy, the routine basic things that you would say, you know what, oh, that's easy. I don't have a problem with that. I'll put it off until a couple years from now. Do them. Do them at the recommended time, because we have studies on the entire population for a reason. These screening measures save lives, and they give you early detection. Your relationship with your physician, to me, is equally as important. Your emphasis on anti-aging and focusing on those elements that are affecting you, and you said it earlier, each patient is tailored differently than the other. Each patient has their own history, unique to them, and you can apply the general screenings to everybody, but specific ones, you really have to hear about the patient who's got the breast cancer in their family in their 40s, and you have to really take the time to encourage that person to do the early detection, because that's really what's satisfying in what we do, and that's what's going to be satisfying for the patient when they leave and they discover, you know what, I really followed through on this, and this really played out. That was time well spent. That was an initiative well spent. I really took the step. I took the time to do this. And again, I would hope that everybody would go for years and years and not really discover anything. And that's a satisfaction as well. Sometimes people go and they get their screening done and they check out and everything's perfect, and they're exercising and they have a good, and they really are, they spend a year, 2 years, 3 years, and nothing happens. That's great. Enjoy those. Get gratification out of being well when it is well. But be prepared for the upcoming times as well.
Well, back to my personal example from last December is that I woke up and my leg was much bigger than it normally should have been. I went to the urgent care and they gave me a script for some antibiotic. And my wife said, no, you're going to go see the doctor. And we came to see you about 4 o'clock, 4:30 in the afternoon, and you took one look and you said, you're leaving here, you're going directly to the hospital, and you wrote me an admission ticket to get over there right away. And I went home and got my laptop and my charger for my phone and my glasses and my backpack, because I had some court hearings the next day I had to get to. So I did follow your instructions, and I took it, but I wound up being in there for 3 days. But the fact that when you told me, you've talked to me before about stuff, and I said, okay, yeah. This time you had a look in your eye and you said, get over there, and I did, and I really appreciate that. That was really cool. You can come to the office, but Executive Health Services, you were doing something a little bit unique a few years ago. Mm-hmm. It turns out you're ahead of the curve. Talk about that and how that applies to patients' care now.
Yeah, so I think in the mid 2013, 14, 15, we started picking up on the fact that people have busy lives, and people really, they want to know their results, they want to discuss their results, they want to follow up on their results, but they're really very busy. A lot of people have agendas, they have evening meetings, they have life, they have time commitments, family commitments, and we said, video visits, I would much rather have a video visit with a patient and educate them on what they need to change, and then the patient not having any visit. So we said, we're going to employ this. We're going to employ telehealth in our office. And at the time, we didn't know about an upcoming pandemic. And we didn't know that, 4 or 5 years later, this was going to become a norm for 2-3 years. Here comes COVID. We were already, a lot of our patients already knew. They have a specific cell number that they text to our office already. They already have video visits already established. It wasn't foreign to a lot of our patients. And so that part of medicine is something that is very important for us to stay connected with our patients, whether it's urgent visits or whether it's follow-ups to explain or educate, or whether it's follow-up on their results. And now that everybody, after the pandemic, they kind of stayed back and they did a lot of these. Now that the pandemic is over, I think if you really have a busy lifestyle, we still have, I think, a lot of patients still using that aspect of it. And I actually dedicate two half days a week just for the video visits. Throughout the day, you'll still work in people that, can't come in. And it's still very well received, and I think it's here to stay. And I think you should probably, the ones who in your audience that are listening, they should really take advantage of at least, connecting with their physician for the preventative screenings even. That's okay. Connect with them, get your screenings done, get everything done, and discuss it with your physician. And then when you really have to come in and take time out of your busy schedule, then you can come in person as well. But I think that part of medicine is here to stay, and I think it's, as you can tell, it's been very helpful to us and to our patients.
The analogy I have is when I do court cases, a lot of the perfunctory things, zoom it. But a trial, I need to be able to see and to hear and to smell the witness, okay? And you can't get that personal touch over, but the important things are that's kind of important. Right. We're down to our last about 2 minutes, Doc. Mm-hmm. This has gone by. What if you can sum up again, the recap, the important things about prevention, taking care of yourself, health, weight, where do you want to go?
I hope everybody that's listening is really taking away the points that we emphasized on. Mainly, really, is give yourself the time that it deserves to relax. That's an advice that I'll tell myself and my relatives more often, that is probably going to be the most important element, is the time to you, the time for relaxation, the time away. That's equally as important medicine as anything, is lower the stress level and that relationship with your physician. I hope everybody that's listening really seeks out a physician that they really can connect and bond with, and they stay with them for a long time and on to their good health.
Well, I'm going to say that my personal doctor, Dr. Wassim Younes, and what's the address of your place?
We're on Mason.
Mason Street in West Dearborn.
Yep.
South of Michigan Avenue.
Mm-hmm.
Great location. Staff is pretty friendly. They put up with me, so that's a really good thing. Where do you see in the future? Like 1 minute ago, where do you see the future of your practice going? And you're still a young guy, so I'll hopefully be around till I'm 99.
Right. Yeah. For our specific practice, we're going to be multi-physicians that are primary care physicians, and we had another female physician join us recently that finished at Beaumont. We have a specialist who does rheumatology with us, and we have another specialist who does nephrology as well. And so we're probably going to have other specialists that are going to be associated with us as well, and we're going to try to really take the personalized medicine to the next level in the next few years to go.
And I can say without reservation that if you want a great place to go to take care of you, not just your health, but your whole person, this guy right here, Wassim Younes.
Appreciate you.
Thanks a lot,
Gary.
Doc. Thank you for tuning in to KiwaniTalk. I'm Gary Gardner. See you next time, and I'm trying to lose some more weight between next time and then. Bye-bye.